Hi everyone, my name is Carissa Murray and I'm going to be explaining how to put on donning sterile gloves. The first thing you need to do is determine what size glove you need. You want to make sure you have the appropriate size. You want to assess the glove package for any expiration dates or any holes or tears. You want to make sure that the package is dry and it's not contaminated. You want to determine where you will be opening the wrapper. You want to make sure that you have a sterile field. You want to also make sure that the surface is waist high to prevent contamination to the field. You want to follow your initial implementation steps located on in the inside cover for the procedure during which you will be working at the patient's bedside. You want to open the outer wrap and discard it. You want to touch the outside of the inner wrapper with your bare hands. This part of the inner wrapper will be against the table and is considered unsterile. You want to position the inner wrapper so that the diaphragm on the wrapper indicates that the cuff of the gloves are toward you. You want the inner wrapper being by unfolding the horizontal top and the bottom 1-inch flap. You want to smooth the flap and fold the crease in the paper wrapper to prevent the flaps from folding back downward on themselves after you have unfolded them. You want to maintain sterilicity. You want to only touch the 1-inch outer vertical wrap flaps on the inside wrapper. You want to use your non-dominant hand to pick up the gloves for your dominant hand. You want to place your glove by the folded edge and make certain to lift the glove high enough so that the glove fingertips are at least 4 to 6 inches above the wrapper edge. The inside of the cuff and the glove will not be considered sterile because they will be touched by your bare hands. This helps prevent contamination by touching the package or the surface upon which it lies. You want to align the thumb of the gloves with your thumb before inserting your dominant hand into the glove. You want to pull the glove until it is snugged above your wrist. You want to make sure that you keep your hands in front of your waist. This way that the gloves won't become contaminated, and anything below the waist level is considered contaminated. You want to pick up the second sterile glove with your sterile glove fingers underneath the cuff, between the cuff and the sterile palmar surface of the glove. This way the sterile glove has touched only sterile surfaces and the glove for the non-dominant hand. You want to slide your non-dominant hand into the glove before being sure that the thumb of the glove aligns with your thumb. You want to make sure that the glove fits snuggle and tight with your non-dominant hand. You want to make sure that that both hands slip the gloved fingers of your dominant hand underneath the cuff flap of the non-dominant hand and pull the cuff up using the glove fingers only. Keep the dominant hand thumb abducted. Using the glove thumbs will likely cause contamination at the cuffs unfolds. When you slip the glove fingers of the non-dominant hand underneath the cuff flap of the glove on your dominant hand, keeping your thumb abducted to prevent contamination. Using the glove fingers only, pull the cuff up most of the way of the forearm, removing your non-dominant hand fingers for underneath the cuff to allow the cuff to recoil against the non-sterile surface of the forearm. You want to then bring both of your gloves above the waist together and press so that you make sure that your glove has you have no room in between the fingers. You also want to follow the initial implementation steps located on the inside of the back cover for procedure during which you are working at the patient's bedside. You want to determine the procedure was completed without contaminating the sterile gloves or the sterile field. You want to evaluate the fit of the gloves to determine if you have the correct size, and they should fit closely without wrinkling, without excess material at the fingertips, or without bowing due to tightness. Bowing due to tightness, excuse me. And that is the way you put on sterile gloves before doing a procedure.